What is health promotion? It is a method to help people develop control over and improve their health by developing social and environmental actions. Health promotion can be achieved through changing policy, developing community and individual skills, knowledge, and providing a supportive environment. Health promotion aims to prevent rather than cure, thus helping to better people's life and outcome and reduce costs on the NHS. It helps to improve life through education, behaviour change, and modification. It can help reduce illness and prevent disease, help reduce crime through reduction in antisocial behaviour such as drunk driving, drugs and alcohol abuse, help increase vaccination uptake such as COVID and thus reduce spread of disease, address very topical issues and concerns such as obesity. By improving health, risk to disease development reduces, which has a positive impact on the resources of the NHS. Health promotion can be delivered on a one-to-one basis to groups such as healthy eating or to masses as nationwide COVID campaign. The purpose to health promotion activity: to help discourage children from starting to smoke and current smokers to think twice. Cyril Chandler completed a study and reported that brand packaging was very important to young adults, and therefore to have unsightly images of the effects of smoking will make the act less appealing. The rationale behind it: the idea was to try and make smoking unglamorous and stop the effect of brand packaging appealing to children and current smokers. Rather than seeing attractive packets, the government has issued a series of photographs demonstrating the effects of smoking. The target audience and how they reach it: young adults, children and current smokers. All packaging must now legally have images and data relating to the effects of smoking. This is introduced to the UK media, by media such as TV, advertising, health promotion clips, billboards, newspapers and magazines, and the internet advertising was also used. Moody studies suggest that the introduction of the larger images in 2016 has increased people's thoughts about quitting and the risks associated with smoking. Davies further supports this, stating that there is 20 million reduction in the amount of cigarettes bought since the policy was introduced.
What we decided to do in 2007 is expand the campaign from Australia and New Zealand to the UK, Canada and the US, and we did that in partnership here with Prostate Cancer UK.
So Prostate Cancer UK has changed a huge amount in the last few years, and the truth is we wouldn't have been able to do that as well and as quickly as we did without the support of the Movember Partnership.
One of the things with Movember in the UK is the enormous amount of money that we've been able to raise in this country, and that's truly transformed then the level of services we're able to provide men and their families going through the journey.
I think one of the greatest things about the partnership between Prostate Cancer UK and Movember is the fact that we've achieved more than double our efforts would have been if we'd done this separately. We've preached and we've demonstrated collaboration all the way through. It's been a real strength of the partnership.
Coming into a marketplace where Prostate Cancer, UK had been around for so long, we instantly tapped into incredible skill set in relation to men's health and prostate cancer in the UK. We had all the education pieces there, and then once we hit the road with Movember, they really helped us with the networks and getting across the country.
There are lots of more exciting things happening with the partnership, and it carries on and grows and gets bigger and goes from strength to strength.
For anyone contemplating doing Movember, whether it's doing it again or for the first time, I always say that by growing your moustache and participating in Movember, I'm guaranteeing you'll have one conversation that will make it all worthwhile.
purpose to health promotion activity, men are encouraged to not shave throughout November and grow a moustache in the hope to increase awareness of men's health and encourage men aged 15 to 49 to check for signs of preventable illnesses such as testicular and prostate cancer and mental health. The rationale behind it: testicular cancer, if detected early, can be treated and cured. Approximately 2,300 men each year are diagnosed with testicular cancer. Testicular cancer is the most common cancer in men aged 15 to 49, yet for many young and middle-aged guys, it's not even on their radar. Over 2,500 men are diagnosed with testicular cancer in the UK, but it's over 98% curable and when detected early requires less treatment. Prostate cancer affects about 400,000 men per year. 3 times as many men commit suicide, aged 40 to 49 of the highest rates. On average, men across the world die 5 years earlier from predominantly preventable illnesses. Target audience is men. It aims to reach target audience through TV advertising, celebrity endorsements such as Liam Payne and Peter Crouch. Celebrities are interviewed in promoting Movember. It is also advertised on billboards, magazines and the internet. Unfortunately, data suggests that men only actively search moustache predominantly for vanity rather than cancer or mental illness. Health promotion. The aim of health promotion is to advocate for better health, reduce health inequalities, and encourage collaborative working between communities, government, charities, and local health providers. Proposed health promotion activity. The proposed activity is a health and wellbeing group for Year 11 pupils. The group will provide a safe and confidential space and time to talk, discuss, learn, and develop ideas about specific challenging topics. The group will discuss a different topic each week which impacts on health and well-being. The sessions will be led by a member of staff who is there to help manage the group and discuss the topic, identify issues, and develop understanding and coping strategies. The staff member can distribute leaflets, handouts, signpost, and talk appropriate staff members for referrals if required. It will be a set programme that runs termly and will accommodate 12 pupils at a time. It takes 45 minutes at lunch break once a week, pupils to bring their packed lunch. The health promotion model. PENDA's 2002 health promotion model focuses not just on the absence of disease and on the emphasis to well-being which can be achieved in changes in behaviour. It focuses on personal experience and action occur accordingly. It is hoped that this model will help focus the HP activity and have the desired behaviour changes. Concepts applied to HP activity. Individual characteristics and experiences. The group will give pupils time to discuss individual beliefs as a result of experience. Behaviour-specific cognitions and effects. The group will discuss perceived thoughts, benefits and beliefs. Behavioural outcomes committed to the plan, competing demands and preferences, and the actual HP activity. Additionally, PENDA suggests that the following subheadings must be applied to ensure success. Personal factors, this must be considered, and all participants to be respectful to each other. They include biological, sociological, and psychological. Perceived benefits of action, what the pupils hope to gain. Perceived barriers to action, time, attitudes, shyness and embarrassment. Perceived self-efficacy, believe in own self to change behaviour. Activity-related effect, each session should ensure pupils leave with a positive mind to ensure increase in self-efficacy and positive behaviour. Interpersonal influences, be aware of circumstances that may be difficult to discuss and share, may have repercussions, confidentiality issues, may need further input and support from other sources. Situational influences ensure the environment is private, uninterrupted and safe. Commitment to plan of action, ensure each pupil commits to the programme and fully participates. Immediate competing demands and preferences, ensure that across school are aware of lunchtime commitment and and ensure pupil fully commits to full-term programme. Health promoting behaviour, enhancing positive health and well-being through change perceptions, enhanced understanding, discussion, sharing, developing strategies and signposting. Rationale. Adolescent years are known to be difficult and pupils can experience many changes and challenges at this time. Pupils can struggle with exam pressure and struggle with pressure to pass their exams, body image, stress, relationships, time management, bullying. Social media. Heavy social media use negatively affects mental health and in particular can make young girls feel hopeless. It can cause unhealthy comparisons that lead to bullying. Identity has always been associated with teenage years, but since the pandemic, mental health relating to this has grown. Bailey suggests that 60% of young adults couldn't be themselves for fear of being judged. Exam pressure. Lockdown caused a huge change in schooling. Teenagers felt a drop in peer and teacher support and struggled alone with results pressure. Mental health was greatly affected with massive increases in anxiety. According to the ONS, pupils felt that having someone to talk to, a safe place to be open and not judged were important to being happy. They believe being listened to and empowered are essential to well-being. The group will provide a safe and confidential environment to talk through issues, develop understanding, and develop a plan strategy to move forward. The BMJ stated that self-harm had tripled over the past 10 years. This is being more prevalent in teenage girls, but men are more likely to commit suicide. Obviously, if anyone discloses the feeling of wanting to self-harm, this will have to be disclosed to the safeguarding officer. Again, feelings, knowledge, coping strategies, help available will be discussed within the group. The graph below demonstrates the dramatic increase in suicidal children in the UK. This obviously only shows that some people have been referred, not the many youngsters who are suffering in silence and may be self-harming without anyone's knowledge. To introduce a lunchtime health and wellbeing club that runs once a week for a term. Referrals can be self, tutor, teacher, parents, or other. A 45-minute session will be overseen by a teacher to establish boundaries, maintain confidentiality unless there is a risk to self or others, keep the group on track and focused, help develop a deeper understanding, help to signpost, support, make referrals where required. Pupils will bring their packed lunch with them. It will be a set programme and run termly. Pupils can make further suggestions to add to the content as appropriate. Goals and outcomes. To enhance coping strategies and skills, to enhance education, to promote a positive self-perception, to enhance self-belief, to provide a safe and trusting environment, to enhance health and well-being. The overall aim is to help develop positive thinking, well-being and enhance mental health. Group activity rationale. A group will have a maximum of 12 participants, so it is manageable and does not feel overwhelming. The aim is to discuss the particular topic, share experiences and thoughts, and as a group develop positive strategies, thoughts and understanding. Groups are ideal to enable the sharing of experiences providing there is confidentiality and boundaries. It is important that the leader manages the group to ensure the same individuals do not dominate and allow pupils to participate. It is important that no one feels judged or laughed at, as this will ruin the whole activity and prevent further engagement. Discussing difficult topics as part of a group can give an element of safety and the group can provide support and solutions. Resources. A quiet and uninterrupted room, table and chairs, agreed boundaries and confidentiality rules, leaflets, handouts, information for signposting, tissues, water, plastic cups, whiteboard and pens, evaluation form, suggestions box, attendance records. How to evaluate effectiveness. To evaluate the effectiveness of the HP form, firstly, attendance and engagement will be monitored. There will be an anonymous suggestions box to help develop and progress the programme. Finally, an end of the programme questionnaire will evaluate participants' views, whether the programme has helped and how to further develop the programme. Questionnaire. How were you referred to the group? Was it yourself, a teacher, tutor, parents or other? What concerns do you have about health and well-being, stress, relationships, financial, body image, sexuality, internet, social media, healthy or unhealthy eating, time management, bullying, cyberbullying? Is the lunchtime sessions convenient? Does the room offer privacy and security? Do you feel confidentiality is afforded? Do you feel welcome and heard within the group? Have you learned and developed understanding and awareness on various issues? Has the programme helped you? If so, with what and how? Would you recommend it? What suggestions would you make to enhance this programme? Evaluation. Short and medium term effects impact can be reviewed, mid-term and necessary amendments made. Long-term consequences, outcomes will be fed back to the head teacher for review of whether the programme was considered successful and to be repeated or developed and rolled out further. The data collection will hopefully demonstrate whether the correct audience was targeted, if changes need to be made, or roll the programme out to more pupils. The data will be qualitative as it will collect participants' views and outcomes. Any lessons learned, whether positive or negative, will be shared across the school, which will impact on further development and enhancement of the service.